have been in clinical practice now for 15 years. I did train here in Toronto as a naturopath. My focus has always been on metabolic syndrome. So I've always helped people with obesity and diabetes and related conditions to metabolic syndrome. I did move away right after I finished school to my native country in Mozambique. So I was there for 10 years, and for the last 5 years I've been back in Toronto.
Perfect.
I do work currently for a program called IDM, Intensive Dietary Management Program. So it's a program that focuses on helping people with metabolic syndrome through some dietary changes, but mostly intermittent fasting.
Perfect. And that's what we're here for. IF, the big intermittent fasting. In the last 5 or 10 years, it has taken off, right? People are using it not only for health purposes, but also a way to lose weight. I'm here because I know a little about intermittent fasting, but I want to get it from the expert. What is intermittent fasting?
Okay, so basically fasting just means a period of a period where you're not fed. Okay, so that could be an overnight period, the period between your meals. It's not something, I know it sounds scary, but it's something that we do all the time, right?
Yes.
Anytime that you're not eating, you're fasting.
All right. So people might know it as is 5 to 2. What is 5 to 2 intermittent fasting?
So I think there's a couple of definitions of the 5 to 2. I wonder what your definition of 5 to 2 is.
Well, I know there's 7 days in the week. That's right. So you fast for 2 days and you eat regularly for the next 5. Is that
there
it?
you go. So we actually have a lot of people doing 5-2 where they fast for 5 days and they eat for 2 days. So that's why I was saying. And there's another famous 5-2 which is actually based on a calorie reduction.
Okay.
And so we won't talk about that because that's not something that we actually believe in.
Okay.
And we actually do think that fasting and calorie reduction are two very different things.
Okay.
So we won't talk about that 5-2, but this famous 5-2 that you talk about, fasting for 2 days and eating for 5, is a type of, can be a type of fasting. So there's a lot of different protocols. There's a 16-8 protocol, which means that you fast for 16 hours and you eat for 8 hours.
Okay.
There's a 24-hour protocol, also known as OMAD, which is 1 meal a day, where people fast for 24 hours and eat 1 meal.
Yes.
It's not my favorite, but it is one of the fasting protocols. And then there's alternate day fasts, as they call it, meaning that you eat one day and you fast the next, and you eat one day and you fast the next.
Right.
Then the next step after that would be extended fast. So instead of IF, it would be EF.
What is EF?
So EF are basically 2+ days of fasting.
Oh, right.
So this 5-2 that you talk about is a type of EF because it is a prolonged fast. It's 2 full days of not eating, right?
Wow. Okay.
It's more advisable if you are going to do EF that you be very well informed, very well hydrated, and probably with proper medical supervision.
Okay.
Depending. So I would recommend fasting in general, whether it be for health prevention or even to help reverse conditions associated to metabolic syndrome.
Okay.
I do think it's a great adjunct to a low-carb, high-fat diet because people who follow a low-carb, high-fat diet naturally fast for longer periods than people who follow a more standard diet, a higher carb diet.
Fair enough. And what is it sustainable? Can intermittent fasting last forever, or do you intermittent fast within a period?
I think, again, we fast all the time. We just don't realize it. And so you can prolong your fasting periods and you can play with different fasting schedules. You can do random fasts where sometimes you're doing this and next week you're doing that. So can it be sustainable? I think so, absolutely. I always joke with my patients that life is very wavy, so we have to learn how to surf. And so maybe you can teach us some other activities besides surfing, but the thing is, you're not doing the same thing every day. You don't have to do the same thing every day, and actually your body would prefer that you didn't do the same thing every day.
I like that.
So it can be very sustainable.
Okay, perfect.
You decide, is today an eating day or a fasting day? And so if it's an eating day, you might want to look into all these different options. Low carb, high fat, as I said, is really my go-to. It's helped me a lot in my own health concerns, and it's obviously helped people quite a bit. It does help to deal with things like cravings, and really, I believe in fasting and feasting. So you need to be well fed in order to have greater ease at fasting.
That's a very good point. Repeat that for me. You have to be
well fed in order to have a greater ease at fasting. So fasting is a lot easier if you're better fed. starvation and fasting is probably not the best combination, and I would stay away from that. So a low carb diet mixed with fasting is not going to be as easy on the body, and your metabolism is going to get harmed in the long term. So having like a low fat, low carb diet, there's a lot of these diets out there. People utilize these low calorie diets to try to help lose weight, and they're not very sustainable.
Okay.
But the combination of these with fasting is also not the best. And this is why people feel like they need to snack all the time when they're on these low calorie diets.
Very nice. So you said you have to feast well to be able to fast better, right? But a lot of people, does this mean that you, after fasting and it's time to eat, do you make up for all the time you were fasting?
Well, we don't focus on calories. So if you mean like you would consume all the calories that you didn't eat the day before, not necessarily.
Okay.
But there is, you do want to have a good metabolism, and you want to consume enough calories. Okay. So I try to spend as little time as possible talking about calories. Okay. You should eat until you're satisfied.
All right.
And really, the key thing with fasting, so this is why the 16-8, it's one of the fasting schedules where you fast for 16 hours and you eat during an 8-hour period. Yep. Preferably, you're having two main meals in that 8-hour period. Okay. So you break your fast and you have a nice rich meal. Yep. And then you go 6 to 8 hours until your next meal. Okay. And then you have another great meal. So not only are you fasting for these 16 to 18 hours overnight, but in between your meals, you're also fasting for a period of time. And that's really important for your insulin levels. So insulin is a big topic. It's a very important hormone that our body produces every time that we eat. Of course, there's foods that produce more insulin or that cause more of an insulin response in our body. Okay. And of course, specifically, the more refined carbohydrates are going to have a much bigger insulin response. Okay. But anytime that you eat, most natural foods are a combination of carbs, protein, and fat. Yes, so every time that you eat, you have an insulin response. So you could fast for longer periods, which is great, and your body will probably do well by having longer fasting periods so that insulin gets pushed down. Because insulin is a retention hormone. It causes retention. It causes gain. It causes you want to be able to go into a burning state every once in a while and in between your meals. That's the perfect balance between a fasted state and a fed state. Okay. All right. Okay. What's happening lately is that people are eating all the time. Yes. They're snacking constantly because they've been told to. Yes. And so you're constantly in a fed state, in a storing state. You want to have a good balance between fasting and feasting, or being fed and fasted. Perfect. Okay. All right.
That makes sense. Now, there's adverse effect to everything, right? What are the drawbacks of fasting?
Well, if people are on medication, number one, you have to find out if the medication that you're on, how that's going to affect your blood sugars, for example, right? So for diabetics that are on hypoglycemics, you have to figure out which of your medications can be taken on a fasted day and which may cause hypoglycemia. So these are emergency sort of situations that should be dealt with a proper professional, the medical doctor, okay? Yeah. But there are other very common things that people will feel when they go on a lower carb diet or when they start fasting. Okay. As your insulin starts to drop, your body goes into this release mode, right? Which is great. Yeah. You get rid of a lot of inflammation, a lot of retention, lots of stuff.
It's like detoxing, right?
Well, it can be seen as a detox, right? Because you're getting rid of unwanted things. Yeah. But you may dehydrate if you're not properly hydrated. Okay. So then we talk about hydration, not just water, but some electrolytes. Okay. And this is key. You could get some dizziness, and it's not from lack of food necessarily, but it's from lack of electrolytes or from losing a little too much electrolytes. Okay. So that needs to be figured out too. Okay.
What about like slowing down metabolism? Is that a possibility as well?
That's a very good question. So that's why it's important to figure out the difference between fasting and a low-calorie diet. Okay. So fasting just means that you're not eating. Yes. Whereas a low-calorie diet, you're eating small amounts. Okay. So a low-calorie diet can reduce over time, will reduce your metabolism, but fasting will not. Oh, wow. Because you're not actually reducing your calories, you're just not eating. And so your body goes into a whole different hormonal and physiological process when you're not eating. And then remember that on your eating days, you're eating a proper caloric diet. So it's intermittent between fasting and eating a very good caloric diet, a proper caloric diet.
Yeah.
So your metabolism should not slow down.
Okay, I've heard stories of people actually gaining weight after fasting, religiously. Can this happen on...
It can.
Yeah?
Yeah, it can, because it depends on what you eat after.
Oh,
so when you're fasting, you're dropping your insulin,
Mm-hmm.
right? You're lowering your insulin, so you go into release mode. When you go back to eating, you're refeeding.
Okay.
So refeed really depends on what you eat. So if you go back to eating a higher calorie diet or a calorie that's going to produce a higher insulin response, you're going to retain. So you will always lose when you lower your insulin.
Wow.
And gain when you raise your insulin. So it really depends on what you go back to eating.
Okay. All right.
And that's where the low carb, high fat diet comes in handy.
Okay. So if you had to recommend intermittent fasting for one or two things, which would it be? Weight gain or a way to cleanse? Weight loss, sorry, not gain.
I
way to cleanse.
I think I got
that.
I think my focus is on metabolic syndrome. So naturally, I'm going to look at things like obesity and diabetes and many associated conditions like fertility and PCOS and fatty liver and sleep apnea. And nowadays, we talk a lot about cancer and Alzheimer's and all these other associated conditions that we believe are associated to insulin resistance. When I look at fasting, I look at it from a metabolic syndrome perspective.
Fair enough.
For sure, my expertise, I think, is weight loss, diabetes, and all these associated conditions.
I'd have to get a second opinion, right?
Yeah, you'd have to go see another naturopath.
Now, look, we can't deny the benefits of intermittent fasting. I've seen it with my own two eyes. Hey, there's nothing wrong with skipping a meal, right? You think we've been overfed in the Western society? Is that why intermittent fasting has been unearthed here? Do you think that was one of the reasons that we have actually been overfed? Is that something you share? Do you believe that, or?
I do. Yeah, I actually do. I think we've been overfed. The quality of the food is poor, but the quantity and the frequency is high.
Okay.
And so unfortunately, I don't think, as you know, I'm from a part of the world that's not considered the Western world, but they now start to follow the exact same diet as the whole. So I don't even think it's a Western problem. I think it's a worldwide problem. Main problem is that people are eating too often. So it's not even that they're eating too much at times. They're just eating too often.
Too often?
They're just snacking too much.
Okay.
Snacking is the major issue, and not just for adults, for children too.
But isn't that one way to increase your metabolism?
That's what they say, but it isn't. No, I don't think that it is at all.
Can you explain?
Sure.
Okay,
so I think that for somebody like you who exercises all day long,
just
all day long, I've seen you. I think that you somehow have managed to find this balance, and so you're burning it off constantly. But the rest of us that are sitting down most of the day are not.
Okay.
And so we are constantly in this feasting state, right? And most of the time, these healthier snacks that we eat are foods that will trigger a higher insulin response because they're mostly carbohydrates.
Yeah.
60 to 80% of people's diets is carbohydrates.
Yeah.
And these are foods that will trigger a very high insulin response. So you're in this retain.
Oh. Okay.
We were talking a little bit earlier about a lot of these diets for weight loss or low calorie diets.
Yeah.
So they're naturally low fat and higher in carbohydrates.
Okay.
And so people, to sustain themselves, end up eating small meals many times a day. And this is what we've been told is a great way to lose weight.
Yeah.
It is not a great way to lose weight because even though you might lose weight initially, because yes, you have reduced your caloric intake while your metabolism is still a bit higher, over time the body adjusts. Your caloric intake is not separate from your energy expenditure. So if you reduce your calories, your expenditure goes down as well. And so you start to burn less.
Okay.
So over time, these low calorie diets are not sustainable. And even if people do lose weight initially, and some people do initially when they go on these lower calorie diets, they stop losing weight. They're doing the exact same thing, but they're not losing weight. They're eating the low calorie, but at this point their metabolism has adjusted and they stop burning.
Fair enough.
The body, and if you increase your caloric intake, your metabolism will catch up. It will go up. you're a different situation, a different case,
Yeah.
because you're constantly exercising.
So I'm burning.
And so you're constantly burning, but the rest of us are not. No, if from a health perspective, physiologically, it's really about the insulin. That's why I've talked so much about insulin. So insulin is this super important hormone that our body produces in a natural state.
And nobody talks of it, right? Nobody
talks of it because people only associate insulin with diabetes.
That's right. That's right.
So if your body, for example, children that have type 1 diabetes, they don't produce enough insulin, so they waste away. And if they don't get insulin injections that they need, they nowadays children get treated luckily and it resolves itself, but they're on a daily injection of insulin. Insulin is an important hormone. All right. So for those of us that are not type 1 diabetics and have a functioning pancreas, our pancreas will produce the insulin as needed every time that we eat. And there are other things that raise our insulin as well.
Yeah.
So this hormonal aspect of this is very, very important, because as people go through life and they eat this higher carb diet and more frequently, they're going to constantly overproduce this hormone called insulin. Yeah. So they'll get into a hyperinsulinemic state.
Okay. Yeah.
A higher than desired insulin state.
Yeah.
This higher insulin state will lead to what's called insulin resistance.
Okay.
And we only recognize that in diabetes, right?
Yes.
People hear that and they think, oh, they're diabetic.
As soon as you hear insulin.
That's right. You think diabetic.
Right? Yeah.
But there's a lot of other associated conditions, right? And heart disease is definitely one of them. You can develop heart disease because of insulin resistance. This is a spectrum of disease.
Yeah.
Okay, so a lot of different expressions on the spectrum.
Okay.
Diabetes is definitely one of them. Obesity is another one.
Yeah.
It's another expression of insulin resistance. Fatty liver is another expression of insulin resistance. And fatty liver can lead to abnormal cholesterol levels, for example, which can lead to other concerns. Hypertension is another one.
Okay.
And so all of these things can lead to diabetes and hypertension and abnormal cholesterol levels. All of these things can lead to heart disease.
Yeah.
And there's a lot of other associated conditions we're now finding out along this path.
Fair enough.
Like PCOS I mentioned a little bit earlier, which is polycystic ovary syndrome, which is what I have or had, which basically means, and it's very common, it's the most common endocrine condition in women.
Yes. Yeah.
And so probably more than 30% of women might actually be afflicted by this.
Now, intermittent fasting, can people get addicted to it and it has adverse effect? If you do it, for instance, and you see, oh yeah, it's working, can it lead to other other eating disorders?
An eating disorder.
Yeah.
So these are two separate things, okay? Eating disorders are psycho-emotional conditions. Which I'm not equipped to even advise on or deal with, but these are different things. These are emotional concerns, psychological concerns.
Okay.
It's not really about what they eat, or it's not really about food. It's about something else.
But can intermittent fasting lead to
an eating disorder? I don't think so, because again, that's a mental condition. It's a psychological condition, and it probably has many causes, but I don't think that diet can cause an eating disorder. Okay. I think it's an underlying condition. So I don't think that fasting will lead to an eating disorder.
Okay.
Although to the untrained eye, it might look similar, but they're two very distinct things with the underlying issue is a totally different issue. I do think that people, as they fast longer, their fasting muscle gets better, as Dr. Fung would say. So Dr. Fung is the medical doctor that one of the co-founders of our program.
Okay, yeah.
And he's written a few books, and he's got lots of videos and lots of information online that for those interested, really he's the best resource out there, no doubt about it.
Okay.
For anyone interested in information about fasting and about insulin resistance.
Dr. Fung, you said?
Dr. Jason Fung. So he's written 3 books. The first one is called The Obesity Code.
Yes.
The second one is actually a practical guide to fasting. It's called The Complete Guide to Fasting.
Yeah.
And the third book is called The Diabetes Code.
Okay.
Our website is idmprogram.com. So IDM stands for Intensive Dietary Management Program.com. And there's lots of resources on there. Videos, lectures, you name it, blogs, articles. He writes a weekly blog. Okay. So he would talk about all of this stuff. But I definitely don't think that eating disorders and fasting are associated in any way.
So continue with your fasting muscles, get accustomed to it.
That's right. So over time, and I'm using one of his expressions, over time your fasting muscle, just like exercise, right? You fast enough and your fasting muscle gets stronger and stronger. So you have greater ease at fasting over time. Right. Okay. But I don't think that even with the people that we've trained, and even myself or other people that fast frequently, I don't think that it's a natural state to always be fasted, just like I don't think it's a natural state to always be fed. Although a lot of our very ill patients are in that state. They're constantly eating. So they're constantly fed, in a fed state. People don't stay in a constant fasting state. It's natural to feel hungry. And so at some point you will, and fasting is a voluntary choice. When people fast, they choose to fast. It's not that they don't feel hungry when they're fasting, right? Even when people during Ramadan, they do feel hunger throughout the day, but they choose to fast on.
I'm starving.
They choose to fast on. And it's the same thing with intermittent fasting. People make a choice. They take the right precautions to make sure that they feel well, they check in on themselves. I always say that fasting is something that you do hourly. You check in on yourself every hour. You know, even with Ramadan, people that are not well, they can't fast.
So okay, for beginners, there's everything beginners. So if you're training somebody to like, I'm a beginner, intermediate. For a person who hasn't fasted before and they come to you and they want to start fasting, how do you start them off? Is there a program? Is there a time frame? Would you say only fast for one day a week, or what's the goal for beginners?
I think that's a great great question, because again, you need to remind people that we fast all the time. So there's no beginners to fasting, right? Everybody fasts for a period of time. So people can start extending their fasting period slowly or as much as they want. As I was saying, you take it 1 hour at a time, right? You can choose to fast. For example, the 16-8 is a great fasting program, meaning that you fast for 16 hours and you eat within that 8-hour period. That, if people follow this consistently, that's going to be a lot more sustainable and a lot more, you're going to see a lot more progress if you do that all the time, as opposed to just throwing in one long fast every once in a while, but then you eat all day long the other days. So just stretching out your fasting periods is important. Your overnight period and also the period in between meals. So focusing on more nourishing, richer meals, so that you're not eating all the time in between meals, so that you feel satisfied and well fed, so that you can have a proper meal later on. Focusing on the main meals is really key, and that's a type of fasting. Actually, I'll tell you, I use exercise as a great mental tool. So I suffered with my first child with postpartum depression, and I did take medication, and fasting and low carb eating really did help with that. But if there's one thing that really helps me when I feel like I feel my whole emotional stability getting quiver a little bit, is exercise. So I'm terrible because I use exercise
just for
when needed.
It's okay, it's always there.
It's always there. But anyway, we're going back to fasting. So I follow a random fasting pattern. Meaning that some days I fast and some days I feast. It's sort of a daily decision. I kind of decide. Sometimes I plan. I like to throw in a 2 or 3 day fast once a month. I think it's really good. It's good to keep everything in check. Keeps me balanced. I do have to prep for that. I'm not someone who goes into fasting as easily as other people, I find.
Fair enough,
I do have to work on my hydration, and I do have to work on my feeding state, meaning that I make sure I have a couple of really good fed days. I'm always well fed, to be totally honest, but anyway, I prep for it. There's a few tools that we can utilize, and then I do throw in a 2 or 3 day fast at least once a month. In the regular weeks, I do a random, or it's not even an alternate day fast. It's more of a random, meaning that if it's an eating day, I eat 2 full meals. So I constantly do the 16-8. That never fails. It's
so
very
that
natural.
And you've been doing this for years.
I've been doing this for years, probably 4 or 5 years. This 16-8 sort of fast.
Fair enough. And you know what? Not to cut you, but you touched 2 important points, and I don't want to forget. You touch being a mother, being pregnant, and you touch on mental state. Now, what does fasting do for you mentally? Because when I fast, it cleanses my mind. I can meditate, I can focus. And a lot of people see things differently. They might think, oh, if you don't eat, you'd have low energy.
No.
But is that because I've been doing it for a long time?
Yeah.
But what does it do for you mentally? So I want you to touch on that. And you're a pregnant woman, you tell them to or moms that are lactating moms, they should keep away from fasting, right?
Well, again, there's a constant daily fast. Everybody fasts, so it's not that you just wouldn't do prolonged fasts.
Okay.
Because you're in any growing state, natural growing state. So children shouldn't fast for extended periods.
Yeah.
Women that are pregnant shouldn't fast for extended periods. And
PMS.
Well, PMS is a great point, and we can talk a little bit about that. But so again, women that are breastfeeding, they should, again, they should be in a proper fed state. Yeah. But again, a proper fed state does not mean eating all the time. Children shouldn't be eating all the time. Pregnant women shouldn't be eating all the time, and breastfeeding women shouldn't. There has to be a proper balance. And the balance for those people might be different than my balance.
Okay.
Right now. Yeah. You talked about PMS. I think PMS is a great topic because it really affects a great bunch of people and really does affect people's quality of life. There isn't enough scientific information on this, but clinically what I have seen and what I believe, and I have done a bit of research on that, is that naturally, again we're going to talk about insulin, but naturally the week before women's period, it does tend to be a higher insulin state, and that's why we feel all that retention and pain and inflammation and irritability. So the irritability point is really important with that mental state. If your insulin is higher, you tend to be more irritable, and the reason for this is higher insulin levels actually do have an impact on your sympathetic nervous system. So this is all related. It's all connected. Yeah. So in that week before your period and you're in this higher insulin state, that's why you feel most of those symptoms, I think, are completely related to a hyperinsulinemic state. So ideally, you would want to bring that insulin down. We were talking about PMS, and so a lot of these symptoms, I think, are related to a hyperinsulinemic state. So technically, you could fasting would be one of the tools to help bring down that insulin. The problem is that most people will find that when their insulin is really high, it's actually pretty hard to fast. That's why going from a higher carbohydrate diet, where your insulin is higher, straight into fasting would be really hard. So that week before the period, that premenstrual week, there are some dietary tools that you can utilize to bring down your insulin. Because there's a lot of cravings, there's a lot of things associated with a higher insulin. So my favorite tool, and that's actually what I do to prep even for a longer fast, is to do something called fat feasting. And so it's just a week where I focus on eating a lot of fiber and fat, and I put, I really keep the carbs and even the animal protein a bit lower. And I keep my fiber and fat really high. These are the two nutrients that are going to have the least insulin response, and they're very satisfying, satiating. So I feel like if I do that for a couple of days, it really does bring down my insulin. All right, it brings down my retention and that irritability. Same thing with the whole mental stability thing. If I ever, and we all feel this at times, if my emotional status ever sort of wavers, I know it's time for me to fat feast.
Wow.
And it helps a lot.
So what you're saying is, if I get this wrong, is in the state of fasting, it can affect your mood. Like they say, hungry, right?
Yeah, they say it's hangry, right? You're hungry and angry.
Yeah.
But that's a different state. Okay, that's again, it's going from a higher carb state or a higher insulin state to a not eating, and that switch is very uncomfortable. So what I'm saying is you can actually prep yourself to go into a fasting state in a much easier way by eating less carbs, more of the nourishing foods like higher fiber and higher fat foods, and then transition more easily into a fast. That's what I'm saying.
Perfect. Okay. Now, thank you so much. I cannot thank you enough for this. If there is anything that we left out in the interview that you'd like to tell people, because I'm going to be putting this on my YouTube channel, is if there's anything you'd want to recommend, anything you want to have people know about intermittent fasting, if there's one thing you'd like them to remember from this interview, what would you say in a rebuttal?
There's a couple of things. We've said it, but I'm going to repeat it. I think it's important that people realize that a fasted state is different than a low calorie state. And that might sound confusing, but it's something to look into because that's really important. All right. And the second thing, which goes hand in hand with that, is that in order to make fasting a little bit easier, we also have to work on our fed state a little bit more, right? Modifying your diet, and we talked a little bit about that now at the end about increasing your fiber, increasing your fat intake.
There's no fasting without feasting, right?
That's right. That's it.
Oh, perfect. Thank you again, Nadia. And look, as I said before, I cannot thank you enough.
Well, my
All
pleasure.
the best.